A local mother says she's being forced to make an impossible choice. Keep her son safe or keep the job that supports them. Caitlin Ross reports working women across the country are facing the same decision as the demands of childcare and the pandemic drag on.
Charisma Freeman says she was doing okay, balancing working from home as a nurse practitioner and caring for her son with a rare genetic disorder as a single mother. That's until last week when she says her company told her she had to return to work in person or leave the company for good.
Cameron's like, we have to wear our masks, Mommy. There's a lot of people there. I don't think we can go there.
9-year-old Cameron understands they have to take precautions because of COVID-19, but his mom Charisma says he can't understand how seriously it could hurt him.
They say, well, not many kids are dying from it, but my son would be part of that small percentage that could possibly die from this.
Cameron has KIF1A, a progressive genetic disorder so rare, his specific mutation is the only known case.
For all we know, our days are numbered. I am not going to add COVID into the mix.
She says as a nurse practitioner for a large company, she's been meeting patients online. She thought it would stay that way until there's a vaccine, but this week she got a call from her manager.
She tells me that my position is no longer virtual. We're going back in the field.
She says her son's doctor told her there's no way she can safely go back to work right now in the healthcare field, but she says her job told her there's no way they can keep her position virtual.
It is a very, very difficult decision. I mean, you talk about it and your heart starts racing.
It's a decision working women with children are making across the United States right now. The latest jobs numbers from the Department of Labor are startling. In September, 865,000 women dropped out of the workforce. That's 4 times the amount of men who dropped out. Unemployment numbers are even more staggering for Black and Latino women at 11%. Charisma says adding a dependent with a disability makes her reality even more difficult.
But it's not just my company, it's a lot of these companies, you know. People with disabilities are invisible.
She says her HR department told her she could take 12 weeks of emergency family medical leave, but that would be unpaid.
So Caitlin, what would the best advice be? What would labor experts advise companies to do to support working women who may be in the same position?
They talk a lot about flexibility, allowing that virtual work from home option if possible, or allowing some flexibility in hours so employees can decide when they get their work done.
Caitlin, thanks a lot. The Department of Public Health tracks cases among Georgia's healthcare workers. They have fallen significantly since the peak in July. Today, there was only one new confirmed case, but overall, women make up more than 80% of confirmed cases among healthcare workers here in the state of Georgia.